Hi, my name is Yuliya Kim. Today I will be doing a presentation video on annual symposium for expecting mothers. I wanted to start off this presentation by explaining what a pregnancy is. A pregnancy is a period in which during a fertilized egg develops into a fetus and then eventually becomes a baby. Pregnancy normally lasts about 40 weeks or about 9 months. It is divided into 3 trimesters. There's first, second, and third. How do you recognize pregnancy? There are pregnancy symptoms, such as morning sickness, missed periods, or breast tenderness. As the baby is developing, the mother is going through a lot of physical and emotional changes. Therefore, prenatal care is important for fetus development. Healthy lifestyle, proper nutrition, and doctor's visits are essential. It is imperative to prepare for pregnancy, to do steps such as check for fertility, to start eating healthier, exercising regularly. After 1 week of pregnancy, implants that are on the uterine wall are called blastocysts. After 2 to 8 weeks, the embryo forms. The next stage is called the zygote, which is now the fertilized ovum. The rest of the time, pregnancy is called the fetus stage. Like I've said earlier, there are 3 stages of pregnancy. First trimester, it happens from a period from 1st to 12 weeks. It is when an embryo forms from a fertilized egg and then it becomes a fetus. This is also when a heartbeat can be heard, and symptoms such as nausea and hormonal changes are happening here. Second trimester. It is a period from 13 through 26 weeks. The fetus grows and starts to become bigger during this stage. Hearing and fingerprint develop during this stage, as well as limbs and facial features. A lot of physical changes do happen here. The last stage is the third trimester. It is a period from 29 to 40 weeks. This is where vital organs develop. It is a final stage. Brain development also happens here. Increased discomfort can be noted, and frequent urination during this final stage is normal. The baby starts to turn its head into a head down position so that it's ready for birth. Here, I included an image that shows the physical changes that a woman is going through from a period from first trimester all the way down to birth. Here, first trimester, second trimester, her belly is much bigger, and then the third trimester. Nutrition before and after pregnancy. Eating is very important. Eating healthy is very important during pregnancy. Avoiding alcohol, smoking, and drugs is a must. And in order to have sufficient amount of energy, by the second trimester, an increase by 340 kcal should be made. By the third trimester, an increase by 450 kcal is suggested. In a day, it is recommended to include no less than 175 grams of carbs, to increase protein intake by 25 grams in your diet. It also should be focused on getting more vitamins, such as vitamin D, calcium, iron, zinc, B12, and folate. I also wanted to explain which foods can contribute to these, can be obtained from these from which foods these vitamins can be obtained. So folic acid can be obtained from leafy greens, legumes, and citrus. Iron can be obtained from red meats, lentils, spinach, fish, and poultry. Calcium obviously can be obtained from dairy and also plant-based milk, leafy greens, and almonds. Vitamin D is the sun. It can be obtained from sunlight and fatty fish. Healthy fats. They can be obtained from avocado, nuts, seeds, and also olive oil. And protein can be obtained from either eggs, lean meat, or legume. Fetal abnormalities that can happen when prenatal nutrition requirements are not met. Abnormal amount of folate is a contributing factor to neural tube defect. Abnormal amount of iron can cause anemia. Calcium is important for bones and teeth. Vitamin D helps calcium to get absorbed and important for bones. Healthy fats are essential for production of hormones and also overall well-being. Protein for muscles are also overall wellness. Contaminants like mercury in fish like this, tuna and swordfish should be avoided. Low birth weight, preterm birth, and being born premature are all fetal abnormalities that can happen when prenatal nutrition requirements are not met. Here I included an image that shows a classification by birth weight. It clearly shows here that low birth weight of infants, there are less than 2,500 grams. Very low birth weight infant is one that's less than 1,500 grams. And an extremely low birth weight infant is someone who is less than 1,000 grams. The normal birth weight I can better explain on the next slide. This slide is showing birth weight of a newborn and factors that can contribute to low or over birth weight. A normal healthy weight for a newborn baby is between 2,500 grams to 4,000 grams. Embryo and fetus do have an effect on birth weight. Teen pregnancy has been linked to low weight at birth, premature birth, stillbirth babies due to vitamin deficiency, and also due to having a more higher likelihood of smoking and not getting the needed prenatal care. Alcohol and other illicit drugs are another factor that can contribute to low or overweight birth weight of infants. Also, conditions like diabetes, hypertension, eclampsia, genetic disorders, kidney, heart, respiratory diseases, and also some medications and certain diets can also be a contributing factor to low or over birth weight babies. Here I just added an image of the classification of gestational age. You can see here by weeks, late preterm infants, full-term infants, and post-term infants. That is why balanced and nutritious diet, as well, also making sure that it is a variety of foods is important for baby and a mom. Environmental impacts on fetal development. Food choices will impact future generations. They cannot change DNA, but they can influence gene expression and pass that on to an offspring. Contaminants like lead, mercury, pesticides can lead to developmental issues. They can also lead to neurological issues. Genetic disorders that affect pregnancy can either be chromosomal or single gene. Those genetic disorders are diseases such as Down syndrome, autism, cancer, diabetes, cystic fibrosis, sickle cell anemia, Tay-Sachs, and many others. That is why it is very important for early detection in order to intervene or to possibly have a treatment. Here I found a very good image that shows environmental effects on a baby and how that can impact different phenotypes of allergic diseases. So I can see here viruses, bacteria, food, smoking, exposure, pollutants, a lot of factors that contribute. Impact of stress and substance. Managing stress and emotional changes is crucial. And if it is needed, there are counseling groups, counseling sessions, because like I've said, it is very important to make sure that stress is not impacting your pregnancy. Stress and other mental health disorders can negatively influence a fetus' immune system and brain. Alcohol is toxic to fetus. It slows down cells and limits oxygen. Alcohol and other illicit drugs can cause birth defects, poor growth, and also poor brain development. There are medications that also should be avoided. Some antibiotics, non-steroidal anti-inflammatory drugs, retinoids, blood pressure medications, blood thinners, some antidepressants, benzodiazepines, some anti-seizure medications, some recongesting medications, ACE inhibitors, some mood stabilizers, and also cannabis should be avoided as it can impact pregnancy. Health of a mother is what we're going to talk about on this slide. Preeclampsia is when a mom has a high blood pressure, and that results in not enough food, nutrients, and oxygen being delivered to baby. Eclampsia is a complication of the preeclampsia. It can result in seizures and even it can result in coma. Anorexic and obese prospective mothers impact. Obesity can lead to gestational diabetes, hypertension, chronic hypertension, preeclampsia, cardiovascular disease, and complications during delivery. Anorexia can lead to nutritional deficiency and hormonal imbalance, also weak immune system. And being anorexic or obese also can lead to low birth weight, preterm birth, or stillbirth, or negatively impact the development of a child. Gestational diabetes is when the high blood sugar causes the developing fetus to get way more energy than it is needed. So it becomes way too big. Consequently, the baby will have breathing issues during birth. Or even after birth, the baby can still have low blood sugar as a result. Sexually transmitted infections. Sexually transmitted infections, or STI, such as chlamydia, hepatitis B, genital herpes, and HIV, can pass from a mother to a baby during giving birth. STI syphilis can pass to a baby during pregnancy. Chlamydia and gonorrhea STI can cause preterm birth of a baby. Syphilis can lead to stillbirth or even death. HIV can cause death, preterm birth, low birth weight, or developmental issues. It is also essential to have constant screenings and checkups if you do have HIV or HPV, because if there is an outbreak happening during giving birth, there is a higher chances of a baby getting it. So it is especially important for HIV and HPV. Here I included a chart that proves that most sexually transmitted infections occur in youth or young adults. Here you can see in 2012 of the total cases. This is a study that's been done. Chlamydia, 40% was the age of 20 to 24. In the second circle here, the blue one, you can see gonorrhea, and the highest is age 20 through 24. It is 35%. This was also done in 2012. The case study that was done in 2011 for HIV, highest was at 28%, from 25 to 34. It is followed by 23%, which is 35 to 44, and 21% ages from 13 to 24. That is why screenings and treatments are essential. Epidemiology is how diseases affect population. Incidence is the number of new cases of a disease during a specific time within a certain population. Prevalence is the number of cases that exist right now within a certain population. Data regarding abnormal fetal development and access to prenatal care by race and ethnicity in the United States. According to the CDC, information that I found stated that non-Hispanic Black women have the highest rate of abnormal fetal development, followed by next Hispanic women, and non-Hispanic white women have the lowest rate. Prenatal care has been increasing over the years, which is promising and good news for us. According to data that was provided by Merchant Times, on average, from 2020 through 2022, white mothers has had the highest rates of early prenatal care, which is 82.8%. Next were Asian Pacific Islanders at 81.3%, followed by Hispanics at 71.7%, African Americans at 68.6%, and last were American Indian Alaska Natives at 64.0%. Here is a chart from a case study that was done in Finger Lakes region. This is for the first trimester prenatal care by race and ethnicity. This is from a period of 2008 through 2015. According to this chart, for Latino and African Americans, it has been increasing during this period of time. Prevention. There are three stages of prevention. Primary prevention is focused on preventing the disease. For example, incorporating healthy lifestyle such as exercise and eating nutritious food, avoiding alcohol and other illicit drugs. Secondary prevention is recognizing the disease early to treat it and to intervene in its progression. For example, starting early treatment and frequent checkups, screenings, and blood tests. Tertiary prevention is aimed to manage the disease and to lessen its damage and its complication. For example, managing the disease with medications or rehabilitation centers and intensive care units. Here I included an image that I found on American College of Cardiology website. It is stating that women are at a greater risk of having a heart disease or a stroke if they did have had the following pregnancy complications, such as high blood pressure or preeclampsia, gestational diabetes, or preterm birth. And it is stating that health problems during pregnancy, even if they disappear afterwards, can signal trouble for your heart. So this was an interesting pick for me. I do want to state that, like I did state that before, but what I did learn from this study is that nutrition is very important. Balanced variety of foods. Poor nutrition can lead to chronic conditions in a baby, such as diabetes, obesity, heart issues. I want to bring an example that happened with my friend's cousin. She was anorexic and she was battling with anorexia for a couple of years prior to getting pregnant. She got pregnant while she was still anorexic. It was hard for her to eat enough, so she couldn't keep up with doctors' recommendations. And she wasn't getting enough nutrients for her and her baby. As a result, she couldn't give birth like she wanted. She wanted to give birth herself, but she couldn't due to being underweight. And she needed a C-section, and also the baby was born with low weight and had to stay at a hospital for about 2 weeks. In conclusion, I also do want to emphasize that preparing for birth is also important. Some people want to give home birth, some people want to go to the hospital, um, but it is important to speak to healthcare professionals beforehand, to make sure that everything is going to go smooth. And also, it is important to educate about yourself about childbirth. There are books, there are classes you can take. There are also a lot of online resources. Also, support groups can be very beneficial. And lastly, I want to thank you for your time and attention. I hope this presentation was informative, and I hope it included all basic and needed information to promote a healthier pregnancy. Thank you.